When a male's sperm cell fertilizes the female XL, new life is started and pregnancy begins. In order to understand how a woman may be protected from becoming pregnant, it is helpful to know what takes place when pregnancy begins. It is inside the woman's body that pregnancy occurs. Low in the frontal area of a woman's body are the reproductive organs. The canal, which leads from an opening on the outside of the body, is called the vagina. The vagina leads to the cervix. The cervix is the lower part of the uterus, sometimes called the worm connected to either side of the uterus, or the two fallopian tubes. Close to the fallopian tubes are the two ovaries and the ovaries, where the eggs are produced, used by one ovary, usually once about every 28 days. The egg remains alive in the fallopian tube from 1 to 2 days. It is during this time when the egg is in the tube that a woman may become pregnant. During sexual intercourse, the male partner's penis is in the vagina. At ejaculation, millions of the male partner's sperm are deposited high in the vagina. Some of the sperm pass through the uterus and into the fallopian tubes. If egg and sperm are in the fallopian tube at the same time, one of the sperm may fertilize the egg. Sperm stay alive for several days. They may arrive in the tube before the egg, or after providing some 4 or 5 days, during which the sperm may fertilize the egg. To avoid unwanted pregnancy, there are several methods of preventing the sperm from joining with the egg. Most people want to decide for themselves how many children they will have and when to handle them. Modern methods of family planning allow people to decide. Several different methods of family planning are available, so people may choose the method which suits them best. In order to choose the one most suitable, all of the methods shall be understood. Many people choose to practice family planning only during the time each month when the egg is in the fallopian tube. Some choose to refrain from sexual intercourse during this time. Others, for those few days, use one of the several methods available to prevent the sperm from reaching the egg. The reliability of this method of family planning depends largely on knowing exactly when the egg is in the fallopian tube. It is generally assumed that the egg is released about 14 days before the beginning of the next menstrual cycle. That is about 14 days before the first day of the next menstrual flow. The egg is believed to stay alive from 1 to 2 days. Sperm which may have arrived in the fallopian tubes from 2 days earlier may still be alive and vigorous, providing another 2 days when sexual relations might result in unwanted pregnancy. Because the length of a woman's menstrual cycle is often longer or shorter from month to month, there probably will be more days during which a woman may become pregnant. This method of family planning requires keeping accurate records for several months, either of the days in the menstrual cycle or the day-to-day changes in a woman's body temperature to determine when the egg is released into the fallopian tube. This can be accomplished with much more accuracy with the help of a doctor or other trained person who can explain the proper procedures. In recent years, more and more people have found the pill to be a simple, effective method of family planning. The pill is the oral contraceptive tablet, which contains synthetic hormones. The synthetic hormones of the pill are designed to affect the action of certain natural hormones in a woman's body. The natural hormones affected are those which cause the ovary to release an egg about every 28 days. These hormones are released normally by the pituitary gland located in the head and sometimes called the master gland. The pituitary releases the hormones which cause the ovary to release an egg about every 28 days. The pill taken regularly provides synthetic hormones in the right combination to prevent this process, and no egg is released. When the sperm arrives in the fallopian tube, there is no egg to be fertilized, which makes it impossible for pregnancy to occur. Since every woman has individual differences in physical and emotional makeup, the pills should only be used on the advice of a doctor. Oral contraceptives are prescribed by the doctor after thorough examination to determine that the pill is suitable for the woman, according to her medical history and present state of health. Another method of family planning: lightweight rubber cap, which is inserted in the vagina. To be effective, the diaphragm must be covered with a spermicidal jelly or cream made for this purpose. The diaphragm acts as a barrier blocking the cervix, preventing the sperm from entering the uterus. The spermicidal jelly provides added protection by killing the sperm on contact. Because women differ in size, the diaphragm is made in a variety of sizes. The doctor must measure and then select the proper size in each case. The fittings should be checked by the doctor from time to time. The diaphragm must be inserted in the vagina by the woman each time before sexual intercourse. and should remain in place for at least 6 hours afterwards. Many people prefer to use a family planning method, which does not have to be remembered each time before the sex act. For some, the IUD, several different types of which are available, has proven to be most suitable. The IUD is an intrauterine device. It is inserted into the uterus by the doctor. Once the intrauterine device is inserted correctly, and may remain in place for years. During sexual relations, neither partner is aware that the IUD is there. Some methods of family planning require the advice and assistance of a doctor or other person trained in proper procedures. The diaphragm must be fitted by the doctor, according to each woman's individual measurements. The intrauterine device must be inserted by the doctor. The pill may be obtained only by doctor's prescription. Determining when the egg is in the fallopian tube is accomplished more accurately with professional assistance. Available for use without professional assistance are the vaginal spermicide foam cream or synthetic gel. Vaginal spermicide ads are inserted into the vagina with a slim plastic applicator, which automatically measures the correct amount for each application. One application is required each time immediately before the sex act. In the vagina, the spermicide will kill the sperm without harming the tissues of the vagina. Also available without a doctor's prescription is the condom or rubber. The condom is used by the male partner, a sheath of thin stretchable rubber. The condom is put over the erect penis. Like condom prevents the sperm from entering the vagina during sexual intercourse. The condom is the only method used in family planning, which is effective to any significant degree in protecting against venereal disease. Thousands of couples are planning their families, choosing the method best suited to them to avoid unwanted pregnancy. When they want to have a baby, they stop using the method of family planning chosen after the baby is born. They begin again to use a chosen method of family planning to avoid another pregnancy until it is wanted. Some couples, after having carefully thought about and talked over every aspect, decided that their family is complete. They may choose to take advantage of the surgical procedures which are available to either partner, and which provide virtually absolute protection against further pregnancy. The surgical procedure available to the male partner is known as the vasectomy. The male reproductive organs on the outside of the body are the two testicles, which are enclosed in a skin sac called the scrotum, and the penis. Sperm. The male reproductive cells are produced in the testicles and move from the testicles through a tube to be stored inside the body. The sperm remains stored in the body until ejaculation, when they leave the body in a special fluid called semen. The male surgical procedure, known as the vasectomy, prevents the sperm from traveling through the tube to be stored inside the body. There is no interference, however, with the travel of the semen, since the semen forms over 90% of the fluid, which leaves the male body at ejaculation. The vasectomy has no effect on the male partner's sexual desire or virility, except perhaps to enhance it, by removing the fear of contributing to unwanted pregnancy. A similar surgical procedure is available to the female partner, known as tubal ligation. It is designed to provide a barrier between the egg and the sperm in the fallopian tubes. These procedures are only for people who have thoughtfully considered and then decided they are sure their family is complete. The vasectomy and the tubal ligation are not reversible, except possibly in a very few cases. For this reason, these surgical procedures should be considered only by those people who are quite sure their family is complete. Family planning is a matter of free and individual choice to those who choose to practice family planning, who wish to decide for themselves when they will have their children, and avoid pregnancy when they do not. A number of different methods are available, which may be used safely and effectively. The best way to learn about family planning methods is by talking to a doctor or a qualified nurse, or by going to a family planning clinic or hospital, a health center, or a public health department in your community. These are the places where people, information, and services are available to assist you.